welcome to Health Matters. My name is Erica Robinson and I'll be your host this week. To give you a brief background, I am a clinical kinesiologist, a registered holistic nutritionist, and I'm currently studying to become a naturopathic doctor in Toronto, Ontario. What I hope to bring to you each week on Health Matters is a more holistic view of health, where we highlight different practices and licensed practitioners that can help you in achieving optimal wellness. It is important to recognize, however, that these practices are best utilized alongside an integrative healthcare team. That includes your medical doctor, any specialists you see, and of course your pharmacist, dentist, and optometrist. The topic for tonight's show is complementary and alternative medicine in the Peel region. It's been shown that over 80% of Canadians currently utilize at least one form of complementary and alternative medicine, also known as CAM. Two of the largest, most utilized, fastest growing, and most heavily regulated fields within CAM are naturopathic medicine and chiropractic care. On tonight's show, I've invited two experts to discuss these fields with us so that we might become a little bit more educated on them. Our first guest will be Dr. Jessica Liu discussing naturopathic medicine, followed in the second half of the show by Dr. Jamie Garvey, who will be talking about chiropractic care. What I want to remind you is that at any point throughout the show, if you have a question for either of these doctors, please call the number at the bottom of your screen. So the first guest that I want to welcome to the show is naturopathic Dr. Jessica Liu. So Dr. Liu is a naturopath who graduated in 2006 from the Canadian College of Naturopathic Medicine. She's been in practice for 5 years and is currently located at the Lakeside Natural Health Center in Port Credit, Mississauga. She practices family medicine with a special interest in women's health, perinatal care, pediatrics, and fertility issues. Dr. Liu is an active member of both the Ontario and the Canadian Association of Naturopathic Doctors, as well as the Association of Perinatal Naturopathic Doctors. So, Dr. Liu, thanks for coming onto the show. My very first question for you of the evening is, what is a naturopathic doctor, or what is naturopathic medicine?
Thanks for having me, Erica. That's actually a great question. And a lot of people do ask, what's the difference between a naturopathic doctor and a medical doctor that you would see all the time? Well, naturopathic doctors have a really important role to play in today's healthcare environment, I think, because of sort of our philosophy to care. Naturopathic doctors are trained to be primary healthcare physicians, which means we can treat both chronic and acute health concerns. Our approach and philosophies are a little bit different than your conventional medical doctor. For instance, we don't use drugs in Ontario, nor do we do surgical procedures. We use gentle, non-toxic therapies to treat a wide range of conditions for our patients. And our philosophy really comes from a place of prevention as opposed to treating things once they get down the road of too far gone. We try to educate our patients on important lifestyle and nutritional guidelines and foundations of health to try to get them back on the road to really optimal wellness and balance.
Well, that sounds really great. I suppose that would be something that even you could see working quite well alongside a medical doctor.
Absolutely.
Even.
You know, I often get questions from people who say, do I need to give up my medical care if I do come to see you? Absolutely not. It's important that you still maintain a relationship with your current family practitioner, but naturopathic doctors are really here to be integrative with your conventional care, let's say. We can really work on sort of those lifestyle issues and dietary issues that are preventing someone from getting back to where they need to be. One great example now is that obesity-related diseases are among the top killers here in North America, and naturopathic doctors are really trained well in dietary and nutritional counseling, and that's one area where we excel and we can really support people in trying to get better.
Wow, that's excellent. I really like the nutritional side of things too, just given that I am a registered holistic nutritionist.
Yeah.
So, and I'm assuming too that you probably have a lot more time to discuss these things, because right now our medical doctors are so busy that it's really hard to have a chance to discuss these kinds of lifestyle changes with their patients.
That is true. You know, we have the luxury to be able to spend that time with our patients. So, a typical first visit is usually an hour to an hour and a half. So that gives us the opportunity to go through a really full health history, family history, other factors that may play into how they're feeling today, such as stress management or exercise or how they eat. And certainly looking at not just the physical aspects of health, but the emotional and spiritual aspects of health as well.
So it really ties in the whole being, not just the physical body at that rate.
Absolutely. One of our principles of care in naturopathic medicine is looking at the whole person. For instance, I've never seen an irritable bowel walk through my door, right?
No.
We're looking at the whole person and treating them as to not just their physical symptoms, but their emotional health as well. And that really ties into how they feel in general and their well-being.
Well, and being somebody that has IBS myself, actually, I can say that emotions are very connected to health. So perhaps you can expand on what's going on there. It's not just, the old school hippie idea of do emotions control health, but on a biochemical level, something's going on there.
There was a book written by somebody named Candace Pert, and she wrote a book called Molecules of Emotion. And in that book, she discusses the relationship between our emotions and physical changes in our biochemistry. So we do know that, feeling sad, for instance, or feeling anxious can have a direct effect on how our gut symptoms are doing, right? So that's why, as a naturopathic doctor, we're not just looking to put a Band-Aid on the symptom or to just treat it temporarily. We're looking to find out and dig the root cause for that symptom. So naturopathic doctors are really about the why of a disease as opposed to the what. So what has created that environment for that symptom to come out in a person, and how do we bring that homeostasis back to that person so that those symptoms don't need to be there anymore?
So it sounds like it's all about achieving balance then within the body.
Absolutely, absolutely, yeah.
And going on that topic, we are still trained in pathology and pathophysiology. So what I wanted to discuss for a second is what services that naturopaths offer that perhaps your patients aren't aware of. Like, for instance, myself, I didn't know that I could see my naturopath for a pap smear and a gynecological exam.
That's right. We are trained in the same sort of clinical skills as your GP would be trained in. We are able to communicate a medical diagnosis and to perform procedures such as blood tests and pap tests and to interpret those results as well. And that's something many people don't know that we do. So oftentimes people, do prefer to come here to see us for those kinds of things because we are equipped to deal with those kinds of problems.
So, and it sounds like the training is quite extensive. So maybe you could shed some light for us on how are naturopaths trained and what kind of rigors do they have to go through for the licensing process?
So the naturopathic doctor program is an accredited program in Ontario, and the school in Ontario, the Canadian College of Naturopathic Medicine, is one of the few accredited schools in the country. And it is a 4-year postgraduate program. And so in that study, we're doing our medical clinical skills, and then we delve into sort of the more naturopathic treatment philosophies.
And perhaps we can, we've got a slide that we can show viewers on the different modalities that naturopaths are trained in.
Sure.
And maybe you could just go through with us the different modalities that you would use in a natural setting.
Absolutely. So obviously nutrition is, and I'm going to say this over and over again, it's the cornerstone of what we do, right? You are really what you eat. And so nutritional counseling is the #1 thing that we'll always go to, and lifestyle counseling to teach people what foods are good for them, what foods are harmful to them, the nutritional value in the foods that we're exposed to in North America. So that really becomes the foundation of what we do. And then we go into trying to identify the root cause of what's creating an imbalance in a person's body, and trying to use either supplements, vitamins, nutrients, or other therapies to try to bring that into balance. And then further along that cascade, if there are symptoms and we need to address those symptoms acutely, we can use natural substances like homeopathic medicines or herbs or other nutritional types of therapies to try to reduce those symptoms and to provide relief for that individual. So for instance, botanical medicine is something we use all the time, and there's so much history in the botanicals that we do use. For instance, acetaminophen comes from the white willow bark, which is a botanical substance, right? So there is so much history in the medicines that we use today pharmaceutically that actually have roots in naturopathic therapies.
I find that really interesting too, and I think it's probably important to mention here too that just because something's natural doesn't necessarily mean that it's safe. So it is important to see somebody who's qualified to discuss these things with you.
Absolutely. There certainly are still side effects to think about when prescribing botanical therapies. So you know, if you are on a medication or if you are concerned about what a certain botanical might be doing in your body, it's always best to seek the advice of a professional. And naturopathic doctors are a trusted professional because we're licensed in Ontario. So it means that if you're seeing somebody who has the title of a naturopathic doctor, you know that they have been rigorously trained and licensed through standards of regulation in Ontario.
That's excellent. And there is also training too in pharmacological interactions, for instance, right? So if somebody is on certain medications, you'll know.
Absolutely. It's our job to know that what we're providing to our patients not only supports them, but doesn't interfere with the medications that their medical doctor has put them on.
Wow, that's great.
Yeah.
I think one thing I also want to touch on, because this is a question that I get asked myself so much, is what exactly is the difference between a naturopathic doctor and a homeopathic doctor? Because while naturopaths use homeopathy, it's a bit of a different ballgame.
And it's a nice question that we're getting now, because it used to be, what is a naturopathic doctor? And now many people do see a naturopath and they want to know, how do they differentiate? A homeopathic practitioner spends a lot of time studying just that, the art of homeopathy. And homeopathy itself is a system of treatment using specific plant, mineral, or animal substances that have been diluted down to a very tiny, minute amount. And it's a beautiful system of medicine, one which naturopathic doctors do utilize in their toolkit, so to speak. There is a little bit of difference. Right now, homeopaths are not yet regulated in Ontario, and that is one thing to note. Naturopathic doctors are licensed practitioners and regulated in Ontario. And we also have a broader scope of practice. For instance, we are able to perform specific medical tests. We are able to communicate diagnoses, and we utilize other therapies in our toolkit, such as nutritional counseling and botanical medicine.
Well, that's great, Dr. Liu. I do know that when we get back from the break, I want to talk about what a perinatal ND is all about. Perhaps very briefly, we can discuss, so we've talked about the licensing, which is quite extensive. And talking about homeopathy just briefly in the final 30 seconds, would you say that naturopaths, while trained in over 6 modalities, do they usually use all of them, or do sometimes they pick and choose?
That's a good point, Erica, and it really is about individualized care. So because we have the luxury to spend that time with our patients and really get to know their full health history, we're able to really tailor our treatment plans to that person. So we'll talk about that more when we get back.
Definitely. I look forward to it.
Thanks very much.
So welcome back to Health Matters. We're discussing naturopathic medicine with Dr. Jessica Liu. I just want to remind you that if you'd like to call in to ask Dr. Liu any questions during this segment, the number is 905-848-LIVE. So, Dr. Liu, looking at your website, it says that you have a special interest in fertility.
Yes.
And this comes from your own personal experience using natural medicine with your own fertility issues.
Right.
So, clearly you've been successful because you now have a 6-month-old baby boy named Jonah.
Yeah, he keeps me on my toes.
So cute. So I'm wondering if you can tell us a bit about your experience with natural medicine and fertility.
You know, it was actually when I was a student that I was dealing with some serious reproductive health issues, which, you know what, is very common now for many women, and it ranges from ovarian cysts to painful periods and endometriosis. You know, infertility, sadly, is becoming a more common scenario that I see in my practice, and 1 out of every 6 couples now, so it's quite sad to see. And there's so much that we can do naturally to help regulate a woman's menstrual cycle and to make their bodies as healthy as possible for a successful conception and also carrying a baby to term. So it's something that I take a lot of pride in my work.
Definitely. So, and clearly you can speak to the success of those kinds of modalities.
Absolutely.
For that.
Yeah.
And now you are on the board of the Association of Perinatal Naturopathic Doctors.
Right.
So perhaps can you just illuminate for us what is a perinatal ND and what kinds of services they provide?
Well, we formed this organization. It was just a group of NDs who were just so passionate about supporting women, not just through pregnancy, but also the fertility aspect, trying to conceive, through pregnancy, having a healthy labor and delivery, and the postpartum period, and then the babies. So naturopathic medicine, I think, is at its best when we're treating children, because that's where we can lay down such a great foundation for good nutrition and healthy eating habits and healthy lifestyle, healthy exercise habits. And that's where it all starts. You know, if we can treat them into the future and prevent chronic diseases from setting in, then we're doing a good job.
And that's definitely something we should aim towards, because I think OHIP is definitely feeling the burden of a lot of these chronic illnesses.
Right.
So this could really help to take the burden off of the system, I think.
Absolutely. I think an integrative healthcare model is where we're going to go in the future, where we have naturopaths working alongside medical doctors, so that we can really improve patient care and allow patients to take ownership for their health as well and feel really good when they make those changes that can make such a huge difference in how they feel.
Mm-hmm. And on that topic right now, I do want to ask, what would you say as a naturopath your ideal model of healthcare would look like?
Exactly that. I could see an interdisciplinary approach where, you know, it's all for one. It's for the good of the patient,
yes.
right? So it's, you know, medical doctors conferring with naturopaths, and we're there to work on prevention and work on improving how the body works so that chronic diseases or acute ones don't set in. So it'll alleviate sort of the burden from the medical side, and working together as a team is where I see patients getting the best benefit out of that.
That sounds fantastic. And I know probably maybe a few decades ago there might have been more resistance between medical doctors and naturopaths, but
right.
I find that even being a student, I'm seeing a lot of integration with the two fields and seeing how we can work together. So do you find it's quite easy to work with medical doctors in obtaining files?
Absolutely. You know, I mean, we're both a highly trained group of professionals. I think there is a place for both in the landscape of healthcare now in Ontario. As you said, there is quite a burden, and I think working together, that's where people will get the most benefit, right? And it's great now that there is a choice, right? Not an either or choice, but a complement to their care, that people can look to naturopaths to support them in, you know, dietary changes, for instance, that their medical doctor wants them to try. And what do they do? Well, that's where naturopaths can really support them.
And I just want to deviate for a second, going back to the pediatric side of things and also tying in the dietary aspect.
Right.
Perhaps you can run us through how natural medicines could affect something such as an ear infection in children, which is very common.
Oh,
so
absolutely.
I was thinking of, you know, if you go to see your medical doctor, you typically treat it with antibiotics. What would the natural approach to something like that look like?
It's very interesting that you mentioned ear infections, because it's so common, right? It's probably
common.
One of the top things I see in my pediatric population. Well, something as simple as changing dietary food intake, avoiding foods that tend to create sort of that tendency towards a compromised immune system, and then ear infections. And most ear infections are known to be viral. So, you know, utilizing that system where we're looking at how they're eating and how we can boost their immune function can really help. Even something as simple as taking out dairy can really reduce a child's incidence of ear infections.
Well, and I've seen good results for that too, just hearing about it from other naturopaths, that it's very effective and they don't have to use any medications in doing that either.
Absolutely, yeah. We've been very successful in treating that.
Wow. Well, another question I have for you is, what kinds of patients see a naturopath, or what kinds of patients can see a naturopathic doctor?
Really, any condition that you would typically see your family practitioner or your GP, we can help you address the same things, whether it's acute like a cold and flu, or something more chronic like arthritis or even high cholesterol. Diabetes and heart disease, that's really up there now alongside cancer, and these are also things that naturopathic doctors can really help people with.
Well, that's great. I want to put that idea on hold for a second. We do have a caller calling in, who we'll put her on now so she can ask her question.
Wonderful.
Oh, sorry. So the caller is not on anymore, but the question that she has for us is naturopathic medicine covered by OHIP?
Right.
And if not, what is the cost like? And perhaps how can people make that cost more easily affordable?
Absolutely. Right now, a naturopathic medicine isn't covered by OHIP, and I'm not sure that there are any immediate plans for that to happen as of yet. But the benefit of it is if this individual has any sort of extended healthcare benefits through her work, then much of naturopathic medicine, the services anyway, can be covered through that venue. So hopefully in the future there will be more avenues or a greater sort of scope in terms of extended healthcare benefits supporting people in their healthcare choices. But it's well worth it. You're investing in your health. A lot of times just seeing a naturopath for a couple of visits can make a huge difference in how you view your health and how you view the diseases that you have, and what you can do to empower yourself to get better.
I mean, it almost seems like we're not quite aware of the cost of healthcare because of OHIP, which is such a great system that we have. But for instance, a visit with a specialist in Ontario is about $450 for 15 minutes, which is paid by taxpayers. So when you compare it to the average cost of a naturopathic visit, it's actually quite cost effective and a huge investment in health, because as you were saying, for 1 hour, you can actually gain quite a bit of education on your condition.
And that is what we strive to do, is we always partner with our patients to educate them on what they can do themselves to feel better every single day.
Well, that's excellent. And now I want to know from you personally what your population looks like that you treat, and perhaps what are the more common conditions that you tend to see?
Well, since I have a passionate interest in women's health, I see a lot of sort of reproductive health challenges, endometriosis, ovarian cysts, and children. I see a lot of children in my practice from birth right up until adolescence, and just being able to walk them through these phases of life and teaching their parents how to really improve their nutrition can do so much for the home and the family dynamic. So I'm quite happy with being blessed that way.
Wow. And you are a primary healthcare practitioner, so that means you don't need to get a prescription to see you. People can come to see you directly,
Yeah, you don't need a referral to see a naturopathic doctor. So, really, if there is a concern that you are typically seeing your medical doctor for, and you would sort of like a naturopathic approach or to complement that, then absolutely.
Well, and another thing that I want to touch on is, can you walk us through a typical visit with a naturopathic doctor from when they first come to see you, or perhaps even when they first call you?
Absolutely. Well, typically a first visit is an hour to an hour and a half in length, and that's where we get really to know the patient very well, their whole health history, all the lifestyle and emotional factors that play into how their symptoms have come about. And then we usually perform physical exam, and there may be some laboratory tests that we may need to perform. And then we go about putting together an individualized treatment plan, which can range in therapies from purely dietary or nutritional to counseling to a prescription for physical exercise, or use of natural therapies like botanicals or homeopathics.
So if somebody, for instance, knows that they want to utilize a certain modality for health, do you recommend they call the naturopath they're interested in beforehand to confirm that they do use that in practice?
Yeah, I mean, all naturopaths, that's the nice thing about being a regulated profession, is that that all naturopaths have that baseline standard of care, and that all of these things are part of our toolkit. If there's a patient that sort of gravitates towards one modality or another, we're certainly open to working with our patients. Absolutely.
And definitely, if there's some that they would perhaps rather not use, we can do that as well.
Oh, absolutely. Yeah, and we look at a patient on an individual case-by-case basis and make a decision together. As I said, we're partnering in health with our patients, so they're, part of the team as much as we are in getting them better.
I like that. It sounds like patients do play a central role in their own care, essentially, and you're making them become an active participant in their care, so it's very empowering.
Absolutely. In my experience, that's what gives us the best results, when people really feel that they're part of that healthcare team, as I said, in getting them better.
So I just wanted to cover one more thing. There are recent surveys coming out from the States that are showing that Americans actually find naturopathic care to be really affordable.
Right.
And because essentially it's more cost effective to stay healthy than to get sick.
Absolutely.
The one thing that they had a slight complaint against was over supplementation. And I think it's easy being in this field to get really eager and excited about helping a patient or a client out. And we know that these things would help them, so we do tend to sometimes overprescribe.
Right.
So what I want to ask you is how are you personally, and how are naturopaths in general trying to work against burdening the patient with taking too many pills?
Absolutely. That's something I think about a lot in my practice, because there are financial constraints, obviously, and we don't want to add stress to a person's life. We want to keep treatment plans relatively simple and easy to follow through on. We always go back to nutrition at my clinic. So, if we can work slowly on changing those lifestyle factors, those are the things that will give them long-term success, and those are the things that they can take home and really fly with, right? Supplementation is really meant to be a short-term treatment plan to get them to a place where they're able to sort of regulate their bodies on their own terms, right? So we try very hard to utilize the fewest and gentlest therapies as possible.
So it really sounds like the basis of naturopathic medicine is lifestyle changes. So while there might be other things we can use to address acute symptoms, that in the end it always comes back to the lifestyle changes.
Absolutely, and we work very hard with our patients to educate them on why a particular lifestyle suggestion is going to help them feel better in their current disease state.
Well, that's excellent. I'd like to thank you for joining us again tonight, Dr. Liu.
Thank you so much,
Erica.
Erica.
I'm glad that you illuminated naturopathic medicine for us.
It's a pleasure.
When we come back to the show, we will be greeted by Dr. Jamie Garvey discussing chiropractic care in the Peel region. Speak into your mic just so they can test.
6. Yeah, he's plugged in.
I hope I don't yawn. I hope I don't yawn.
Yeah, just do another mic check.
1, 2, 3, 4, 5, 6.
Hello and welcome back to Health Matters. Thanks for joining us. On the second half of tonight's show, we will be discussing chiropractic care as part of complementary and alternative medicine. Joining me for this part of the show is Dr. Jamie Garvey. He has his Doctor of Chiropractic. Dr. Garvey holds an undergraduate degree in physical education from Brock University, where he specialized in athletic therapy. He then went on to pursue his degree in chiropractic at the Palmer College of Chiropractic in Iowa. Dr. Garvey has been in practice for over 7 years. You can currently find him helping at a clinic in the Trillium Hospital region, as well as opening his own clinic under Garvey Chiropractic on Kerwin Avenue in central Mississauga. Dr. Garvey is also the founder of 2 not-for-profit organizations. The first one, Doctors for Education, is aimed at getting multidisciplinary healthcare practitioners into the community to discuss health and wellness. They educate on the importance of natural health remedies and a balanced lifestyle to achieve peak performance or potential. The second foundation that Dr. Garvey has founded is the Chiropractic Cancer Foundation for Children, or CCFFC. Their mission is to provide complementary quality chiropractic care to children with cancer throughout the world. They currently have over 200 chiropractors on board who volunteer their time. Dr. Garvey has been nominated recently for Entrepreneur of the Year by Ernst & Young for his work with the CCFFC. So Dr. Garvey, welcome to the show. I think I have the same question for you that I asked Dr. Liu. For you, what is chiropractic medicine, or what does a chiropractor do?
Thank you, Erica. As Dr. Liu mentioned, it's all about philosophy. It's about why we do something. And that forms the foundation of our application of that philosophy, art. So we have a philosophy, we have an art, its implementation, and then the science that proves if it works or not. I'm not talking about the scientific method, I'm talking about true truth. And as you can tell from the numbers I think you mentioned when we first got on this show, chiropractic is one of the #1 healthcare professions out there. And it's because that philosophy, that art, and that science are so congruent.
So what is the essential philosophy underlying chiropractic then as a treatment modality?
Prevention. And the body heals itself. If you can understand that, the body needs no help, just no interference. I think if we put our efforts into prevention, which is kind of the big word with a lot of these, we're going to say alternative healthcare, but we're not really alternative anymore. We're mainstream, right? Naturopath, chiropractic, we're mainstream because people are waking up and understanding that there's a better life out there than micromanaging the physiology and the biochemistry of the body through a drug or pill. We're walking around just dropping pills in our body thinking, yeah, that's going to help us. It's not the right answer. And people are, those that are educated enough to entertain some of these alternative methods, so to speak, are getting the value of that. And that's the beauty of it.
So then when somebody sees a chiropractor, what exactly are you doing, or what is your art with this?
The art. With chiropractic, I'm a little bit of a purist. I'm called straight or principle. That means all I do is adjust. I move the right bone at the right time to the right degree, and my only job is to locate, analyze, and correct spinal interference to the nervous system. I don't cure anything. I don't heal anything. I simply put the body in a better position to function. The body takes care of itself. It's that simple.
So again, it's almost an empowering form of medicine because you are giving the body what it needs to just rebalance itself or regain homeostasis, essentially.
Yeah, it empowers the body's a self-healing organism, and when we think that we can step in and interfere with that creation, we want to question ourselves. What knowledge do we really have? We don't really know anything from the beginning of man time to today, till the eternities, and all that knowledge together, we still know nothing. So why do we think that we're going to try to cure cancer with some magical pill, or we're going to cure heart disease, or it's all in the prevention component. Isn't it smart to build a fence from the start rather than have an ambulance down the valley? And although we need the ambulance down the valley, it's all about prevention. Imagine if we took all the money from all the organizations and put them towards cleaning out our food, our water, and our air, right? What do you think is going to happen? Major things, major health is going to happen.
Do you think that in itself could lead to a reduction in a lot of the issues that we're seeing now, like for instance cancer?
How can it not? Like what is cancer? An abnormal growth of cells that gets out of control based on what? A breakdown of communication somewhere? Isn't that what dis-ease is, or disease is a breakdown of communication? So how do we address that? You go to the underlying cause or the underlying definition of what health is, and then maybe we can go back to understanding how do we solve it, or how do we obtain it, or maintain it more appropriately, or not interfere with it.
So it sounds like it's about reducing interference. And perhaps you can shed some light on what exactly a subluxation is to sort of trace backwards here.
I tell my patients the only two words that you need to know: subluxation and adjustment. A subluxation is a misalignment of a vertebrae, and there's what's called the vertebral subluxation complex. And through chiropractic, we have different understandings of that word, but basically we're looking at nerve irritation or inflammation potential. And we're looking at the overall function of vertebrae. We're looking at, me specifically, I can adjust extremities. So I'm looking at joints that don't have good fluid ranges of motion. So you want a nice range of motion, and that's what people are concerned with. But I want a nice fluid. So if my arm only functioned like this, and we can feel those sometimes, and if we can locate them in our spine, and we know they're not working properly, and if we can take that pressure off, then we can get a little bit more balance.
So it's like you're taking compression off the nerves, so you're essentially allowing the nervous system to function more appropriately, right?
Indirectly, we work with the nervous system. How that works, there's many different theories and understandings of it. Who cares? It works. The science is there. It works. Take the pressure off the body, educate the patient on what's causing the stress in the first place, and let the body heal itself. Walk.
I was once at a health seminar, and I heard a chiropractor say that anybody who experiences the force of gravity can use an adjustment. So perhaps you can tell us, is there truth to that, and what kinds of patients in general can see a chiropractor?
What is gravity? Like 9.8 meters per second squared. So we have on ourselves stresses in our life, and we can break them down to what? Physical, chemical, and mentally emotional. Physical, accidents, injuries, trauma, poor posture, inappropriate exercise, too much exercise, whatever it is. Chemical is our food, water, our air, cleaning products in our home. Mentally emotional is like work stress, relationship stress, basically your perspective on life, your philosophy, where you came from, where you're going, why you're here. And all those implement on the body as a stress, either positive or negative. And that in and of itself is the understanding of education. Educate you on what's causing the stress, adjust the body, heal.
So what you're saying then is stress, even from sources such as our jobs, could potentially be taking our spine out of alignment or causing a subluxation.
Going back to the question, because I have a little bit of ADD, I'm going back and like, who needs chiropractic, right? I get caught up. Who needs chiropractic, and how can that stress be placed? Yeah, from the very birth process, the first subluxation occurs. Being pulled out, forceps, suction. We're looking at monitoring children, just like Dr. Lou said, monitoring children as they grow up. As the twig is bent, there grows the tree. If patients come to me and they have riddled with osteoarthritis, degeneration, if I had them as a kid, what would happen? I could have prevented some of that potentially, right? Makes sense?
Well, now what I want to go over are some common things that I hear about chiropractic, and perhaps you can either validate their truth or debunk any myths. So you probably have heard most of what I'm going to say. The first one that I really hear from people is, I crack my own back, so I don't need to see a professional to do it for me. So what would your response be to that?
Aside from getting into the physiology and the anatomy of it, I don't adjust myself. I have my own chiropractor. For the simple reason, it's moving the right bone at the right time to the right degree, and balancing the spine from a biomechanical view is where you need to be, rather than manipulating joints that are hypermobile potentially and causing further osteoarthritis. Chiropractic, there's some literature out there that's showing that chiropractic can potentially prevent osteoarthritis and degenerative disc disease, because we're allowing joints to function more efficiently. Where if you manipulate yourself, you're probably moving the bones that are hypermobile and causing a worse condition.
So it could even be worsening this then.
Research shows that it is, yeah.
And what about the people who just crack normally in everyday movements? What's going on with that, or can you speculate at all?
That goes into a lot more research, but we're human beings. We're going to crack and pop once in a while. It's just like we live in a world where we're dynamic creatures. So it's things that are consistent that are more of a concern that we want to look into a little bit further. But the odd crack and pop, I'm not going to worry about that unless obviously if there's, you're hearing a lot of pain associated with it. So this is another issue that I want to look at too. If there's pain associated with it, definitely look into it.
So that's probably something you would delve into in an initial intake, right?
Yeah, 70% of the time these subluxations occur, they're asymptomatic. We don't know that they're there. So we can be walking around like you don't know you have cancer until 10 or 15 years later. Heart disease, the first symptom of heart disease is what? Second decade of life. So, or, you know, we know that there's signs of heart disease in that early stage. So, yeah.
And in a typical intake, what kind of evidence do you gather, or what kinds of things? Do you do any x-rays, any other diagnostic procedures?
The same as a normal medical doctor would, or naturopath, or you know, we take a case history, we find out what's going on. I like to take full spine x-rays, do a biomechanical analysis. I get a lot of pieces of information from that. We have other pieces of equipment that we do in the clinic. It's really finding out innately what's going on with the person, seeing what they truly need. Adjusting the spine is very simple for me. I've been doing it for enough years, and it's simple for me. Education and changing the person's behavior and understanding and philosophy, this is where education, this is the more difficult portion sometimes.
So patients aren't only seeing you for adjustments, though, they're also getting this education. You're also teaching them a bit about nutrition, about a healthy, balanced lifestyle. Is that right?
Well, they put doctor in front of my name, so doctor in Latin means teacher, so I might as well teach them something, because that's, why am I going to get someone in, you know, dependent upon me where they have to come and say, do this or do that, do this, what do I do, doc? Educate them on a philosophy and a principle and understanding. They'll take care of themselves, make them independent, you know, that's the way.
Now, going back to the commonly heard things, another one that I hear is people are interested in chiropractic, but they're very afraid of the neck or the cervical adjustments. So can you maybe tell us why they're afraid, but as well as I hear them say, you know, I'll see a chiropractor, but I just don't want my neck adjusted. So what would your response be to that?
And I love some of those people, and I tell them there's a great chiropractor down the road, because I'm balancing a system. And those that are educated and those that have done their research know that there's that chiropractic is the safest and most effective type of healthcare. Neck pain, back pain, it's just what it is. That's the reality of it. So it's not an issue for me. It's probably the most important adjustment to the cervical spine because of that first and second cervical vertebrae. We have a nervous system that's an electrical system, and it goes all the way down our spine. If there's a problem with the electrical system, there's going to be a problem with what? The physical matter, the body.
Now, Dr. Garvey, in the last 30 seconds of this segment, perhaps you can tell us about, a lot of people ask, why is a visit with a chiropractor so short most of the time? Why is it only 5 to 10 minutes long?
I don't have to sit there and cuddle with you for half an hour or massage you. Nothing against massage therapists or anything like that. My job is very specific as a chiropractor. I go in there and, as I said, move the right bone at the right time to the right degree. I balance the system. All I'm doing is making sure the spine is working properly, and if extremities need to be addressed, and sit back and let the body heal itself. I don't need to spend more time.
Well, that's great. Thanks, Dr. Garvey. We'll be coming back in the next segment to discuss more about chiropractic care. Welcome back to Health Matters. We're sitting down with Dr. Jamie Garvey, Doctor of Chiropractic in the Mississauga region, to discuss chiropractic. Now, we were just on the topic of common things that people say regarding chiropractic. So there is one more that I want to touch on, which is I'm afraid to see a chiropractor because I think that once I start seeing them, I'll always have to see them. So what's your response to that?
They're afraid?
You think they're afraid of it?
No. I guess my understanding, it's, no question is a stupid question, but some questions aren't as smart as others. If I train someone at the gym and I got them in shape, okay, you're never gonna have to exercise again. Or if you educate someone on diet, you're never gonna have to eat healthy because you ate healthy for a week. It's about maintenance. You change the oil in your car because you know that it lasts. Your car engine's gonna last longer. When people function at this level, they're going to feel that they function at this level, and they're going to function like a finely tuned race car. And with chiropractic, we get a lot of people to that level. We get people functioning more efficiently. So if you feel that way, and then all of a sudden you stop, you're like, I don't feel as good, I don't have as much. Well, why do you think? Maybe there's a correlation between chiropractic and feeling good. Do you have to go with the rest of your life? No, we don't take away your free agency, but you have choice, but you probably are going to feel a lot better when you maintain your schedule of care. And I think you're going to ask me another question about maintenance of care, schedules of care. I'm going to get into that right now.
Yeah, let's talk about what is a typical plan, a treatment plan like with a chiropractor.
Getting you out of pain, you can come in for one adjustment. Some people have crawled in and then run out. One adjustment if you only want to deal with symptoms, we're the best place for you. Come in.
I think I've seen you do that, actually.
We're going to give you a couple of adjustments, and you're going to probably feel better. Okay. There's symptom-based care. There's reconstruction, and then there's maintenance. I'm the doctor, you're the boss. Pick what you want. I'm going to get you out of pain, then I'm going to retrain your joints to function more efficiently over a period of time, then I'm going to maintain what we've worked so hard to attain. I tell all my patients that it's pretty straightforward. You can take as little or as much as you want.
And so if somebody isn't in any form of acute pain, can they still be coming to see you, and what phase would they be entering in on?
Let's go back to the definition of health and disease. Health is the body's ability to communicate efficiently enough with the stress that is placed upon it. Dis-ease, and it's only one word difference. Disease is the body's inability to communicate efficiently enough with the stress that is placed upon it. So what we're getting on is a definition of health, not just the absence of disease and infirmity, but total optimal well-being and expression, social, mental, physical. This is the true, like Dorland's Medical Dictionary says this. So what do we want to do? I don't care about your symptomatology. Someone comes in with neck pain or back pain, great, I'm not really that excited about it. I'm worried about immune system, digestive, circulatory. If I can affect possibly any of those, that's when we're rocking and rolling. If I can allow you to communicate more efficiently, what's going to happen? If I had chiropractic care all my life, would I have had cancer when I was 11? I don't know. But the probability is that if I was functioning at a higher capacity, could my immune system maybe be stimulated? Would it be function at that? Could it fight that cancer? Great question. I'd like to entertain that.
Well, there's definitely a lot of ideas there that I want to touch on. And as you said, I think a lot of people associate chiropractic care with those acute things. Like we do know research-wise that it's
There's our
great
reputation,
for that.
right?
Yeah, it's great for lower back pain, it's great for tension-type headaches and neck pain. So what do you find patients are surprised to learn that chiropractic also affects? For instance, you touched on digestion and issues like that.
Clinically, in my history, I've had patients coming in, walking out with visual clarity after an adjustment. They've noticed that. They've noticed that bowel and bladder. One lady, she went to the washroom once every 7 days. She came with lower back pain. We adjusted her. We balanced the entire spine. I adjusted her cervical spine. She had no pain in her cervical spine. She came back, she goes, Doc, I'm having regular bowel movements now. I tell this story because it's like there's a connection there between balancing the body. She went to the washroom once every 7 days. Now she's going, that's healthy. That's living, right? Heart conditions I believe have been assisted. There's some research out there with chiropractic and blood pressure. I've noticed significant drops in blood pressure. A lady came to me once, she went to St. Michael's Hospital for 4 years under extensive drugs. They tried to lower blood pressure through all these medicines. They said, we can't help you, but here, take these medications anyway. And about, I think it was 2 or 3 weeks where her blood pressure came normal, and their blood pressure was high for like 16 years.
Wow.
What is that? Now, it's a case study. That means did A cause B? We don't know, but is the correlation there? Yeah, there's definitely something that we need to look into, and it's happened again and again and again. And if someone slaps you in the face again and again and again, you pretty much know that it's probably going to happen again and again and again. And it just works, and that's the beautiful thing. And there's dozens and dozens and dozens and dozens, hundreds of things that I could go on about. Yeah.
So it's definitely interesting because I think a lot of people only associate it with the back pain and the neck pain. So that is great to know that it has such large systemic effects on the rest of the body. going back to what you mentioned
the
about
body heal. Chiropractic doesn't do anything. I don't cure anything. It's simply the body heals itself. Just take the pressure off. So that's the thing that people don't understand. You know, you don't want to get blamed for curing cancer. You don't want to get blamed for heart, you know, helping someone's heart. I take no credit. It's simply the body's ability to heal. And when you give that credit and you have that understanding, this is where it takes place.
I really like that philosophy. And again, it's always coming back to empowering our own
I think
physiology.
you follow that philosophy.
I do follow that philosophy.
Nice.
So again, just touching on your own experiences, you touched on if I had done chiropractic my whole life, would I have gotten cancer at age 11? So I want to talk about those experiences. You are a 2-time cancer survivor, having had it both in childhood as leukemia and then later in your young adulthood. Perhaps can you tell us about how these experiences shaped your involvement or your creation of the CCFFC as well as your chiropractic career?
You know, you're the sum of all your experiences, right? You're the product of everything that's happened to you. Why do I do what I do? Why am I driven to the extent that I am? It's simply looking at an alternative way. Can I say that chemotherapy and radiation cures cancer? I can say that it definitely has an effect. What percentages are out there? You can do the research. Is there a less invasive way? Is there, you know, is there a more humane way to take care of a child that's 11 rather than dosing them with chemotherapy and radiation? Because the whole philosophy in medicine is that we're going to micromanage everything, and hopefully the cancer dies before the body does. And we're brought down to the basic state with the immune system, you know, kidney damage, liver damage. I have potential heart damage as a result of all these medications, and it's like we got rid of the cancer, but there you go. It's wrong. There must be a better answer. So this drove me to understand, okay, let's help people without hurting them. And I'm not cutting up the medical profession. I'm just saying there's major limitations with it. What drives me is allowing every child in the entire world to have free access to free chiropractic care. Does chiropractic cure cancer? No. But can we take stress off the body? Yeah. Can we educate them on a more organic lifestyle? Yeah, 100%. Isn't that the big idea? Isn't that the big idea about changing someone's whole paradigm from eating crap to eating good, garbage in, garbage out, marvelous in, marvelous out? Who's buying, like, who's selling you what you're buying? That's the big question. I would rather sell someone something that's pure and healthy rather than have someone else come, because 1 out of every 3 commercials is a drug commercial, 1 out of every 5, whatever it is, I don't know the stats on it. It's rough. So, driven to form this organization. We have doctors around the world that have said, you know what, doc, this is a phenomenal idea. Let's represent it. And we're developing. It takes time to develop this because we're interviewing every doctor. They need to provide a little bit of an understanding of their philosophy and their types of techniques, depending upon what schools they went to and how they look at chiropractic. We don't want people that are going to sit there and just do ultrasound and differential. Not that there's anything wrong with that, but that's not chiropractic. I believe chiropractic is more of the finding that adjustment, moving the spine, making sure, you know, once again, principled is what we're looking for in this organization. I think is more representative.
And if a child is receiving chemotherapy or radiation, are they still welcome to receive the complementary chiropractic care from the CCFFC?
Of course, yeah. This is, you know, we're not going to fight against the medical doctors. Medical doctors right now are referring their patients to us because they know that chiropractic works. There's even medical doctors that are learning how to manipulate. I don't think it's obviously as specific as chiropractic, but they're seeing the value, and they're seeing their patients turn from medicine to chiropractic and say, wow, let's work together rather than against each other. And medical doctors are accepting chiropractic. Those that are more educated, that have done their research, that know that we're, even from the basic lower back neck pain, but then they get the bigger idea and they're like, wow, there's something there. There's something there. You know, I remember following this medical doctor around. A lady came in with 13 bottles of pills, and I said, Doc, what's going on here? Hypertension and heart disease. You know, she's got hypertension. I don't know if she had diabetes, but I said, Doc, diabetes type 2. I go, Doc, what do you think we can do? You think we can prescribe some exercise? I was just following the doctor around. Yeah, but I don't have really time to explain some of that. Well, who's going to explain it to them? You just have 13 bottles of pills you don't mind prescribing, but you're not going to give them an education to prevent some of this in the first place, because we know exercise and diet is a major contributing factor to health. Did I just pull a Charlie Sheen there? All right, what else is new?
So again, and even I myself was surprised to discover exactly how holistic chiropractic care truly is, because it isn't just the nervous system, it's the whole body.
It's a philosophy. It's an education. It's a way to look at life. Like when I was going to school, I remember visiting this chiro, and he goes, and I'm like, it's just a job. But when I graduated and I got the big idea, when finally something knocked me on the head, that quarter-inch of skull, something penetrated through there and changed my whole paradigm. It's the way I live. It's in everything that I do. It's in the purified water. I don't know if this is tap water, but it's in every decision that I do. And we try to do as much as we can do. And at the end of the day, you're only saved by grace, right? So, yeah.
And perhaps in the last little bit of the show, you can tell us what the future plans are for the Chiropractic Cancer Foundation for Children.
The Chiropractic Cancer Foundation for Children will take care of itself. This will be an organization that will continue to grow. My next focus is to build a cancer camp for children. This is what I've always wanted to do. I will utilize the Chiropractic Cancer Foundation for Children to help use that as the CCFFC as a vehicle to build that camp. But that's my phase 3 of my 5-year goal. So hopefully within the next couple of years, I'll be looking at purchasing a piece of land up north and building that. And maybe we'll get David Suzuki and Vanilla Ice and Mike Holmes. Is that, you know?
Have your
and
own
get,
reality
get
show.
all those guys in there. Get a reality show and build this beautiful
together.
cancer camp, and we'll have an earth shelter and solar panel. Yeah, it's gonna be great. So
it sounds great.
yeah,
Some big dreams for the future.
Yeah, tell those 3 people to give me a call, and we're gonna rock and roll, and we're gonna get something
Have
done.
the
If
Dr.
not-
Garvey reality show.
Yeah, I don't know about that, but we'll get those 3 doing a reality show. It'll be more interesting.
That's excellent.
Yep.
Well, that's about it for tonight's show. I hope we shed some more light for you onto complementary and alternative medicine in the Peel region. We met with Dr. Jessica Liu and we discussed naturopathic medicine, followed by Dr. Jamie Garvey discussing chiropractic care in Peel. Please join me next week when the topic will be water as a healing modality. We'll be joined by guest Dr. Kaganovsky to discuss hydrotherapy and its implications for health, followed by Sarah DeRuiter talking about the spa that she is the director of, Body Blitz Health by Water for Women. So that's it for tonight. I'm Eric Robinson. Have yourself a very healthy week.